5:26 on this Wellness Wednesday. Children born prematurely may struggle more in school than children born after 9 months. A University of Edinburgh study found that more than half of children born before 32 weeks weren't ready for school at the age of 5 and were behind in communication, language, and physical and emotional development. Preterm birth is a leading cause of atypical brain development and cognitive impairment. Children born during the COVID lockdowns are finding it more difficult to focus, follow instructions, or regulate their emotions. That's according to new research in England that found the lack of social interactions some children experienced during the pandemic affected them years later. But children born during the pandemic were also found to have language skills at or even above pre-pandemic levels. A trip to a museum or a theater could slow your aging. Another study in England found that people who regularly went to a museum, theater, or an art gallery had a physiological age 3 years younger than people who didn't. Physiological age includes things like blood pressure, cholesterol, and body mass index. But the study's authors note that people more engaged with culture tend to also be wealthier and have better overall health. We are learning more about the sudden death of Senator Lindsey Graham. He died on Saturday night from a tear in his artery, according to preliminary findings from a medical examiner. And this cardiac event happens quickly, but there are ways to lower your risk. Mandy Gaither explains.
It's the largest blood vessel in the body. The aorta is the first place blood travels through as it's pumped from the heart to the other parts of the body. A tear inside of it can disrupt critical blood flow, often quickly, without much warning.
Eventually, it reaches this tipping point where the wall of the aorta gives way. And so it starts to tear and unravel and come apart.
Dr. Eric Roselli performs aortic surgeries just about every day at Cleveland Clinic. He says before an aortic dissection happens, there's already been a degenerative problem in the aorta. That's why he says it's important to know your family medical history. If a relative has had a sudden death, an aortic dissection, or died from the condition, get imaging to make sure you don't have an underlying issue.
It doesn't cause you any symptoms till the minute it's killing you. And so it's usually found incidentally when a study is done for some other reason, or if we're screening family members.
Roselli says another risk factor is hypertension and to be screened for high blood pressure by age 25. If there's a problem, it can be managed through heart-healthy lifestyle choices and, if prescribed, medication. And if there's an abrupt onset severe chest, back, or neck pain, seek immediate emergency care.
If you have an aneurysm, and we find an aneurysm, we can treat it very safely with a planned operation to take care of the aneurysm before the dissection occurs.
For Health Minute, I'm Mandy Gaither.